All right, we are going live, and that's it.
Right. Hello, thank you everyone for joining us today. My name is Vanessa. I'm with the Dallas Public Library, and we partner with the Department of Environmental Quality and Sustainability on this Earth Day Everyday program series. So thank you so much for joining us today. Just a few housekeeping things. You will be on mute during the presentation. However, if you have questions for any of the presenters or any comments, you can put those in the chat, and we'll get to those after the presentations by the presenters. Also, this meeting is being recorded. So I believe we have disabled everyone's video, so you don't have to worry about appearing, but just so you know, it is being recorded. So a link will be sent out after the program, so you can share that if it's something you think other people may, want to see, or also just to watch yourself. Maybe you missed something, you can see the presentation again. Right, so I'm gonna go ahead and turn it over to Kevin with OEQS, and he'll introduce our speakers for today.
Thank you, Vanessa. It's nice to be here. This is our last in the series of air quality focused presentations. And I think we may have saved the best for last. We have three speakers with us today. First up will be Rachel McGregor from Texas Trees Foundation, and she will be followed by Yolanda Penegrees. Did I say that right?
Penegidze. That's
okay. Sorry. And Akshay Arora from the Parkland Center for Clinical Innovation, PCCI, which is an organization that's kind of new to us, and we're really looking forward to their presentation. But first up is Rachel, and Rachel is the new urban forestry manager with Texas Trees Foundation. Before she was with Texas Trees Foundation, she was with the Texas A&M Forest Service for quite a few years, and she's going to talk to us on urban heat island. And just before she gets started, and before I kick it off to Rachel, I just want to say that Texas Trees Foundation has been a great friend to the city of Dallas and a great partner on a lot of projects and more projects in the future. And with that, Rachel, thank you for all of y'all's support, and take it away.
Yeah, thank you, Kevin. Okay, so I'm going to talk about the urban heat island effects. Can everyone see that?
Yes, ma'am.
Okay, so just kind of what this presentation is going to be about is simply urban heat island effects and what those are, and then kind of toward the end I'll explain what Texas Trees Foundation, or TTF, is doing in a lot of different ways to change that and make it better for all of us. So I'll get started on that. And I do want to say too, if you have any questions as I'm going through this presentation, feel free to type those in the chat, and we can kind of answer those as we go or hit them at the end. So, first I'll start with saying what TTF, or the Texas Trees Foundation, actually does. So we are an urban forestry nonprofit focused on preserving and expanding the public parks and green spaces, not only for the city of Dallas, but we are Texas Trees, so for the state of Texas, and educating the community on the importance of urban forestry as well. A lot of the time, I know many people haven't heard the words urban forestry, and actually connecting the awareness and that urban forestry is our trees in our cities, in our urban areas, and those have a tremendous effect on our mental health, physical health, and so many other things as well, and we'll kind of talk about those as we go on. So what are heat islands? Those are structures such as buildings and roads that absorb and re-emit the sun's heat. So mainly what you're thinking about is like gray infrastructure, and especially when in high concentrated areas. So think like downtown or the Southwest Medical District in Dallas. They're concentrated areas of great infrastructure. And that gray infrastructure has limited green infrastructure, so not much vegetation or woody material, so no tree, not as many trees in those areas, which makes those islands. And so as those islands occur and more, the temperature in those areas is extremely high, and we get an extreme variance of temperature in those areas versus, say, a rural area. And these pockets can cause tremendous problems with our health. These lead to hotter days and even hotter nights in our urban areas. So this graph kind of shows in the late afternoon, the temperature at different areas throughout our cities. So rural farmland obviously is going to be the coolest area. And then our city centers are our hottest areas. And we can contribute that to our green infrastructure, our trees that do help reduce temperature through evapotranspiration. So the example I kind of like to give everyone to make that connection is, think about sitting outside enjoying your meal on a patio, and they have the misting fans. So think about think about transpiration through a tree like those misting fans. No, you can't see it, but if you actually stand under a tree, you can feel that versus saying standing on the blacktop. The other day we went out kind of for a media release, and I had the temperature gun, and that was the first. I mean, obviously we all know standing under a tree, that's where we want to be, right? It is cooler than standing on the blacktop, but I wanted to see the variation between the two temperatures. So we took the temperature gun out there, and there was literally about 33 degrees difference. And this was only around 11, 12 o'clock. So, you know, that's not even the hottest part of the day. 3 o'clock is typically the hottest part of the day. So that blacktop, those darker structures tend to hang on to that heat and really heat up things. So under those trees is cooler, and we can all connect that to our green infrastructure. So what drives the urban heat island effect? Number one is going to be, you know, the loss of vegetation, deforestation. Number two, you're looking at, as we build more and more homes, more and more developments, centralizing areas of neighborhoods. Three is more of that condensed gray infrastructure, lots of buildings and roads and concrete all together in those areas, really creating those islands of heat. And then gas and emissions. That's all going to contribute to these hotter temperatures, these heat that you see from the urban heat island effect. So this kind of just shows that most large cities in the US are warming obviously faster and at twice the rate of, say, a rural area. And also you can contribute that to your green infrastructure. The heat island is the highest temperature, and it's in those intensely developed zones. So where we have that, again, going back to that gray infrastructure, that highly intense developed areas where we don't have as many trees in those areas, and they are seen as islands. They're separated from the green infrastructure, so they're just those hotter temperatures in those areas, and that kind of just drives home where we should start planting, helping us figure out. And so definitely one of these was done over Dallas. We did the urban heat island study, and we noticed that the Southwest Medical District was an area that, you know, needed more trees. But also we have a Cool Schools program, and, you know, we noticed in a lot of our schools, we don't have a lot of tree canopy coverage as well. So that's why we have the Cool Schools program and plant more trees on campuses as well. So how we're impacted, more than 80% of Americans live in urban areas. That's a huge number of Americans living in hotter areas. And those heat wave deter outdoor activities. So when you limit your outdoor activity, that can increase health problems as well. So we look at the chronic health diseases, and trees can help reduce at least 5 of those. So we're looking at cancer, obesity, asthma, and trees can help reduce all of those. Not all community members are equally affected by extreme heat. So the older population and the younger population experience extreme heat more acutely. So what are the solutions? Obviously, cooler materials that are lighter in color, or providing more of that green infrastructure. So what we learned from here, if you look at the pictures on the right, the area, that blacktop that I had mentioned earlier, that absorbs more of that heat. That is more radiant heat coming off that blacktop. So when I was talking about taking the temperature gun out there and measuring the temperature radiating from that blacktop, it was 33 degrees higher than, say, under the canopy of a tree on pavement as well. I did not take the ground temperature under the canopy of the tree. I took the pavement temperature under the canopy of the tree, and that blacktop was still 33 degrees hotter. So that's the extreme temperature difference that we're getting in these areas. So when we use lighter material, it reflects the sunlight away. It's not absorbing that heat. And when we plant trees as well, they are transpiring, keeping the air cooler there as well. So solutions, again, would be that greening strategies, those trees transpiring, those roots absorbing that water, the water is taken up through the leaves. And again, there's stomates or stomatas underneath the leaves on the bottom of the leaf surface. And that's where transpiration is happening through those stomatas. And that's when I was talking about the example of kind of being a mister on a patio. No, you don't see it, but that's what's going on. And that's why it's cooler. So say in a park, you may want to sit under a tree. It's cooler under the trees versus on that blacktop. So planting more trees in those areas to help, but also lighter colored materials, using lighter colored materials that won't absorb that heat as much. So trees help by, tree planting is 3 times more effective than other cooling methods. Obviously, this whole PowerPoint has reiterated how hot it is in areas with less trees. The net cooling of a young, healthy tree is the equivalent to 10 room-sized air conditioners. So again, that transpiration that happens under those trees. And then those roads that have 20% shade have a 60% reduction in resurfacing cost over 30 years. So you're not having as much road damage either from that heat. So you're saving money, saving time, in these areas as well, but then also with the cleaner, the tree roots are helping with cleaner water, being able to absorb a lot of the time in these flooding situations, they're being able to absorb that water as well. So you have cleaner water, cleaner air, because again, that tree is functioning and storing carbon that is in our atmosphere. The tree is able to sequester that carbon and store that carbon. So we have cleaner air, so less pollution in these urban areas. So how can we help? Obviously, we want to preserve what we have. Planting a smaller tree, cut, especially in areas with construction or development, we do want to conserve and preserve our larger trees. Taking away, an example would be the tornado that happened in Dallas. Those were large trees that were lost. Yes, we can go back and replant trees, but those were larger trees, meaning that they did sequester more carbon, and they were larger, transpired more, kept things cooler in a larger area. So we do want to preserve our older growth forest as well. But we want to help plant new trees in all of these areas too. So we want regeneration. We want succession. We want sustainability of our trees and of our urban forest. And then we want, as you know, what TTF, we want to be an advocate. We want to promote awareness. We want to promote education to the general public. You know, everyone needs to understand that we are all connected to our green infrastructure and the immediate effects it has on our health. If we saw anything from COVID and being, you know, having to stay away from each other and not being able to be around each other, the state parks were packed with people. You couldn't even get day passes to get in those state parks, and it was because people were feeling the need to get out and get into the green, those green spaces and into those trees for their mental health. So all of this is, you know, every landowner, every person in an urban area, if you own a house, if you're anything, you know, planting those trees, maintaining those trees, speaking up for those trees, and knowing that you are connected to those trees is very important, and keeping that awareness. So I did want to mention directly how TTF, so I did mention the Cool Schools programs that we participate in, and that is planting trees on school campuses in Dallas, and that will continue to expand. And that is because we want to create and educate that connectivity of those children to their communities, directly connect them to their communities, but also teach them of the importance of trees and what a tree does and how a tree directly affects their health. So our Cool Schools are very important with that. We also recently worked with the City of Dallas, Lotta Hill Philanthropies, and Encore, and developed the Dallas Urban Forestry Master Plan 2021, and that was unanimously passed by City Council. And that is a framework for the urban forest in Dallas to help manage that. It is a critical asset and a critical resource for all of us. So the top two goals for that, the first one is to inventory the trees in Dallas. So those street trees, those public parks, any public areas in Dallas, understanding what tree species we have, the health of those trees. So really getting an inventory of our trees in Dallas to help us figure out how to manage that. And then also bringing everyone together is our second goal. There's about 14 different recommendations in this plan, but the second one too was to, it was kind of disjointed on who helps manage the urban forest in Dallas, and we want to bring everyone together on the same page. So this framework, this Urban Forestry Master Plan 2021, is really going to help us be able to do that for the health, obviously, of all of us, and really connecting us to our communities. And then we have the Southwest Medical District, which I've mentioned a few times through this presentation, but it is to help plant trees in the Southwest Medical District where it was noticed from mapping that is a direct area of intense heat, and definitely a heat island, and an area where we do need to plant more trees. If you've ever been in the Southwest Medical District, just going down there, it's hotter, one. It's disconnected, so it's not a contiguous area, not a corridor, say like, you know, wildlife use. They call them corridors, or trees that are connected to move through. Well, people would love that as well. You know, we want to be able to walk from one area to another and not experience that extreme heat either. But also for that cleaner water and cleaner air in the Southwest Medical District, by planting these trees and creating this this plan for this area, it's going to immensely help and support the area, the people that visit that area. Any questions?
I think we may have a couple of questions here. One question is, do urban heat islands have an impact on the local weather?
So direct, yes, I will say yes, they do. Obviously, with the higher temperatures and the way the atmosphere works in that area, those areas, those limited areas, you do. The temperature affects the amount of rainfall you get in those areas as well. So it's definitely it has kind of a microclimate of its own, and so it does directly affect the environment in that area.
I've noticed that in especially in the summertime, if you watch the radar and you think, oh boy, there's storms coming in from the west or the northwest, and you think, okay, we're going to finally get some rain, and then as they approach Fort Worth, the west side of Fort Worth, they just sort of split up and go in different directions, and I've always thought that was probably had something to do with the heat island, but I wasn't sure. The other thing that if I could get you to comment on, this is kind of coming from me, but we found when we did our last greenhouse gas emission inventory that the trees accounted for a lot of carbon sequestration and everything in the Dallas and everything. So I was wondering if I could get you to maybe make a comment on how trees can help with our climate planning and our climate actions.
Sure. So trees definitely do help sequester carbon. They store that carbon in the tree. So they're taking carbon out, making the oxygen that we breathe cleaner air. So that's what helps the air quality. And as you know, those gas emissions, so that starts out lower. That's why we do want any green woody vegetation even lower toward the street level as well, because that's where it starts catching it. But as it goes up through the canopy, the whole tree is able to sequester that carbon and store that carbon and have cleaner air for us to breathe. But yes, that's a big issue that all of our, especially large corporations, are looking at too, for carbon credits and storing that carbon and offsetting the amount of carbon that they're releasing into the atmosphere. So as the green and as everybody jumps on that bandwagon, we're going to see a lot more companies. Even now, that's what TTF is seeing, a lot more companies coming on board with wanting to plant more trees to offset the carbon that they are emitting into our atmosphere.
That's kind of exciting because, like I say, when we did our inventory, we actually we were able to do some calculations, and I don't remember the number, but the Dallas, what do they call it? The urban forest, the great urban forest of Dallas accounted for a lot. I guess one last thing that I've heard some concerns with recently is the emerald ash borer. And I wonder if you could talk about briefly to kind of tell people about what the danger is and why they should be worried about it or why they shouldn't be too worried about it, and just sort of give us kind of some information on that, because I know that a lot of people are concerned with the stories they see on the news, and they're afraid that all of the trees in the area are going to be, gone in 20 years or whatever. So
yeah, so emerald ash borer, or EAB, is not in Dallas County yet. Most of the time it has been spread through firewood. So emerald ash borer affects and kills ash trees, all ash trees. No ash tree is resistant, but just ash trees is what we're talking about. So like oak wilt is on our oak trees. Emerald ash borer is a boring insect, does bore into the tree and kills our ash tree population. That's why the inventory for the Urban Forestry Master Plan is very important as well, is to identify areas that we have higher ash populations and monitor those areas for EAB too. So that urban forestry management plan is critical for maintaining and managing our forest health in Dallas as well. But Denton County and Tarrant County do have emerald ash borer, so it is a matter of time. There are injections for those ash trees, and they need to be done every 3 years. But an emerald ash borer, it makes galleries through the tree, which cuts off flows of nutrients to the top of the tree. And so the tree does not have green leaves to photosynthesize and make food for itself. So that's kind of the layman's way of explaining how it kills the tree. And it does take about 3 to 4 years for the EAB population in that tree to be high enough to kill the trees. But this invasive pest kills healthy trees. It's not just, it's not a borer that just is attracted to a stressed tree. It's an invasive pest that kills healthy ash trees. So that's why it is important to monitor and watch your ash trees and look. There should be a D-shaped exit hole on the trunks of those trees, but you will also see the top of the canopies to start die back. So the leaves at the top of the tree will start to die. You may notice woodpecker activity increasing because they're obviously attracted to those boring insects and eating those. So as the population gets higher in the tree, you may notice that. But the first thing you're going to notice is kind of underneath the bark, you're going to notice holes on the trunk of the tree, and they'll be D-shaped, and they're kind of small in size. And the emerald ash borer is emerald green, so it's kind of like a fluorescent emerald green. And it is smaller. I wish I had a picture of it here, but the Texas A&M Forest Service does set traps to monitor where that EAB, how far it's spreading. I will say, flight-wise, they don't expand an area that fast, but it's the firewood being moved. That's why we always say don't move firewood, because those emerald ash borers are in the firewood, and then we're spreading it to different areas. So,
well, my focus is air pollution, so I always tell people that it's a lot better to use natural gas or electricity for your heat than it is a fire anyway. But I know that doesn't make a lot of impact on some people. One last follow up on that. How widespread are ash trees in our native tree populations in this area?
So Dallas County alone does, I can't, the percentage is skipping my mind, but it is not a large percentage of our overall canopy, but I will say it's the areas that were planted with nothing but ash. So there are older areas, those where developers planted nothing but ash tree after ash tree after ash tree. And those areas are going to be devastated because there's nothing but ash in that area. And if emerald ash borer enters that area, it will devastate it. So just like oak wilt, that's why we don't want, we try to diversify our landscape. Different trees, species help reduce that. When you have something come in that can wipe out a whole population of trees, that's why you want a diverse landscape.
Right.
So.
Right. Okay. I don't think I see any more. Oh, Vanessa put a link to a picture of the emerald ash borer in the chat.
Great.
So thank you, Vanessa. Thank you for doing that. I don't see any more questions in the chat. So thank you very much, Rachel. We appreciate it. Look forward to working with you again, and great presentation.
Great.
Thank you very much.
Thank you for having me.
All right. Bye-bye. Okay, next we're going to follow up with our two folks from PCCI, Yolanda and Akshay. Akshay is a manager of machine learning and engineering, or machine learning engineering. That's all one word. Sorry, I was making that up. You can tell I'm an old guy. He supports PCCI's deployment of predictive models for projects that include sepsis and trauma. He has expertise in designing, building, and integrating data from multiple sources, managing big data, and creating data warehouses, and creating complex queries and programs that optimize the performance of big data ecosystems. He works closely with other members of the PCCI data science team to collect, aggregate, and organize data from clinicians to allow colleagues to begin to build predictive models. And I just want to say, Akshay, I took statistics and high-level statistics in graduate school many years ago, but when I did it, we used IBM punch cards. So I'm a little behind the times. I'm looking forward to you bringing me into the modern age with this, hopefully. Dr. Yolanda Penegrees is a medical doctor with an MS also. She is a senior medical director with PCCI, where she leads population health initiatives. She is a pediatrician and physician scientist with over 20 years of experience in clinical and healthcare leadership. She specializes in leveraging advanced data analytics, technological innovation, care transformation, and social determinants of health to advance, you can tell I'm reading this, advance health equity among vulnerable populations. And I am just tremendously excited to have you both with us today. This is an exciting area where we're taking data and using all the tools that we can to help health outcomes. And you know, it's high time we did this. So I'm looking forward to hearing what you guys have to say. So I'm going to turn it over to y'all. And once again, if you have questions, please put them in the chat and we'll get them answered at the end of the presentation. So without further ado, guys, all yours.
All right. Well, thank you so much, Kevin, for having us. And Akshay and I are very much honored to be part of this presentation. And we are going to try to switch it up a little after the great presentation about how trees help our outdoors and our environment and everything. Along with that, I hope you can see my screen. Akshay and I are going to try to take you indoors. We're going to be talking about how air quality indoors matters, how it affects health, and how important it is to make sure that we think globally when we think about the environment. We have to do things outside, we have to do things inside. Can you see my screen?
Yes, we can.
Okay, that's awesome.
Sorry, it took me a minute to unmute. Yes, your screen looks good. Perfect.
All right. So here we want to explain to folks why it's important to study indoor air pollutants. Why is it that air quality indoors matters? Well, it's first because we spend quite a bit of time indoors, at least 8 to 12 hours indoors. We sleep indoors, and during the night, during our sleep, we can be exposed to any pollution that happens indoors. So that is important. And indoor air pollution actually affects health, right? You know, children, adults with nighttime cough, kids with asthma will have an attack because they've been exposed to something indoors. Sudden infant death syndrome is a part of what happened. It can be caused by some exposure to smoking, which is an indoor air pollutant as well, and recurrent ear infections. Those are things that we know can be affected by indoor air pollution. And when we're looking at air quality, the sensors we put outside to monitor the temperature, humidity, pollen, and everything do not necessarily reflect what's happening indoors, because there are ways that things can change, those pollutants can change from the indoors to the outdoors and vice versa. For instance, someone who smokes inside of the house, they're going to expose the household to secondhand smoking and its consequences. But that will probably not change substantially things happening outdoors, and therefore we would not be able to detect that using outdoor sensors. And like I said, indoor air pollution has some differences in sources compared to outdoors air. We're talking about wood burning, for instance. When it happens indoors, it causes a more substantial concentration of pollutants inside of the house. Cigarette smoking, those are things that expose folks, like a leaking pipe that causes humidity, mold inside of the house. That is part of indoor air pollution. That doesn't necessarily, that's not necessarily measured through anything we're doing on the outdoors. And the interventions we typically use to curb indoor air pollution are substantially different than those that we use for outdoors. That is typically with doing it through education, smoking cessation, housing quality assessment, and referrals. Those are the things that we do. So it matters to understand how indoor air pollution affects health. So these are just a few facts about secondhand smoking, which is one major in the indoor source of indoor air pollution. That it causes about 41,000 adult and 400 infant deaths every year in the US. And again, due to multiple impacts on health, like we said, sudden infant death syndrome, ear infections, asthma exacerbations, lung cancer, and secondhand smoking is not rare at all. We're looking at middle and high school students. Quite a few of them who have never smoked themselves have been exposed to secondhand smoking, either inside a vehicle or at home, or sometimes in the outdoors in indoor public areas. And those are typically things that we can intervene on in a different way to make sure that the air around the individual, where they live indoors, or where they learn indoors, or where they worship indoors, is safe. And this is just a depiction of what some indoor air pollutants can cause to your lungs. So PM2.5 is one tiny microparticle that can travel all the way down to your lungs. It's not going to be stopped. Most of it's not going to be stopped by your usual mechanism for stopping things from getting down your lungs. It's not going to trigger any major cough. It's going to go down and sit all the way into your lungs and can cause a lot of issues down the lungs. Cancer, cause difficulty breathing, asthma exacerbation, chronic cough, obstructive lung diseases. Those are things that can affect our lungs when we're exposed to these kinds of indoors air pollutants. So I'm going to pass it over to you, Akshay, because Akshay has done some wonderful work on looking at how do we measure indoor air pollution, how do we track it, and hopefully use it so we can assist the folks that have those issues in their houses, address them, and improve the quality of the health of their family. So Akshay.
Thanks, Yolande, for setting the stage up, for explaining how air quality affects human life and what are really the things that we need to look at these markers. And so particulate matter, as Dr. Yolande just showed, is one of the key factors that causes air pollution and can seriously deteriorate your health. So how do we use this in our predictive models? So for predictive models, we try to minimize our error, and we want to get as specific as we can to the air quality estimate. So here on the first image on the left, we see this is the most granular that we can go with an outdoor sensor. So this is at a block group level, and it tries to capture PM2.5, that is particulate matter 2.5 microns, PM10, that's 10 microns, and carbon monoxide, nitrogen monoxide air quality. We try to get at the best at the block group level, but it still doesn't tell us how the air quality is actually inside the neighborhood, or is inside or near schools, or near play areas, or near the apartments where children actually live. So that's one of the big disadvantage of outdoor sensors. And on the image on the right shows more of the pollen. And again, at the very granular block group level, we see that the pollen levels look very, very similar. So there's not a lot of difference that actually goes inside the data while you're creating this model. So to address this problem, we decided to try out an indoor experiment to understand the indoor air quality as well as the outdoor air quality. So we created an experiment room, and this is a real room where we had an IoT device, which is an air quality sensor. And this air quality sensor was able to measure all of these properties. So it was able to measure the particulate matter, the humidity, here in this case, the relative humidity, the carbon dioxide, nitrogen monoxide, oxygen gas resistance. So it has all of these sensors baked in this device. And in that room, we left cigarettes and hookah running on for a period of time, and we wanted to observe how the air quality changes of the room before the event and after the event. And we were able to observe very clear patterns where when we did this, we collected this data for nearly few weeks, and then during that experiment we had like few spikes which I would like to share. And one of the spikes that you see here is the PM 2.5 spike that we can see. The value goes, I'm not sure if you can see my mouse, but then you can see the spike where the value suddenly shoots from a level of 10 to 12 on an average, shoots directly above 500 to 1000 and goes back in that period of time. So this effect shows how important was having the air quality sensor inside indoors, and how easily it was able to capture an event of the air deterioration. And we also looked at all other features that would change with a different lag in that same period. So we're observing the same time period, and we see the relative humidity changing, and it also changes as a function of the air quality change. And overall, as you see in the next slide, the overall air quality also showed a spike in the similar time period that we have. All of these are recorded in a very, very similar time period, which reinstantiates that what we are measuring is a bad air quality, or what we are measuring is a sensor that says that the room is affected with some harmful poisonous gases. And just to be very much confirmed, we also saw, like, look at ozone. The pattern looks very neutral. That means it's not just noise, that the air quality sensor is spiking on all the measures. For ozone, it doesn't spike at all. So it just spikes for PM 2.5, PM 10, humidity, and the overall air quality. So long story short, the point that I'm trying to make here is, if you go back to the previous slides. Yeah. So long story short, the point I'm trying to make here is, with this data, you can actually predict your air quality risk inside or near the neighborhood, and that's why air quality indoors is very, very important than you would do it outdoors. It disambiguates, and it gets you more precise to the location of the subject under test while you're doing this. So we hope we can expand on this work and have these air quality sensors placed in multiple schools or some other public areas where we can keep monitoring the air quality and recommend based on these changes. So thank you.
Thank you so much, Akshay. And just to conclude here, so what Akshay is exposing is what we do day in and day out. That is, we try to capture information and data that helps us predict or at least monitor those people who might be at high risk for poor health outcomes here, air quality, and how it impacts our health, and then use that to intervene to improve people's lives on multiple levels. For instance, we readily have access to outdoor air quality data, but having additional insights from indoor air quality improves our ability to tell, for instance, if a child living in a specific neighborhood is at higher risk for ending up with asthma. It also helps us identify those risk factors in the child's home that are are responsible for poor quality of air that might affect their outcomes. And we develop interventions along with the community to improve those activities through education, monitoring, screening, and referring. But also we work together with we engage the policymakers to try to set up those policy programs that would improve these specific risk factors. In this case, for indoor air quality, looking at smoking cessation programs and how folks access that, looking at smoking deterrence, housing inspection, housing support, how we can make sure that we connect all those dots and improve the quality of air indoor at the same time that we are working on improving the quality of air outdoors. And that's it for us. Thank you for the opportunity to present here, and we are open for questions.
Great. That was wonderful. Thank you guys very much. I see we have about 10 minutes or so left for questions. Let me ask a quick one real quick. Many years ago, I worked in a large factory setting, and it was a very old building built in probably the 40s. Is a defense plant, and I noticed that I was, of course, this was also in the days when people still were able to smoke at work and everything. And even though I'm not a smoker, was exposed to a lot of secondhand smoke. But one of the things that I noticed is that working in this old building and everything, that my absentee rate went up dramatically. You know, before that, I was hardly ever sick and never missed work. And the year or so that I was working in this building, I was just, it seemed like I was sick once a month or something. You know, and that was, and then we got the term sick building. And so I'm wondering if this air quality, the things that this air quality or you guys are talking about, how does that relate to the sick building? And you know, can you say something about that? I mean, are these things that impact our wellness, I guess?
Sure, I think that is that's totally a great example, Kevin. It's clear that indoors air quality affects your health. It definitely can affect your work, absenteeism, can affect ED visits for health-related issues. The case in point is children who live in an apartment that has humidity or mold. They are recurrent ED visitors, whether it's for, you know, recurrent chronic sinus infections because they have that irritation in the nose all the time, or recurrent asthma exacerbations. That is a classical sign that a child is probably living in an environment that's not safe. Nighttime coughs, those are the kids that will be coughing and awake all night coughing, and they sleep at school. So you know that it's because the environment inside of the house is a problem. So your sick building makes a lot of sense. There has to have been something in the building, whether it's mold or if it's a building with carpet, you could have dust mites, and those actually can affect you in multiple ways, including, you know, increasing the risk that you're going to get sick or visit the emergency room or just not feel well overall.
If someone thought they might have something like that, how would they go? What would be how would you go about determining for sure that might be causing a problem in your home or your kid's school or where you work?
Exactly. So one of the things is housing inspection. So we typically start first with, of course, screening and asking questions about the usual suspects, right? Are you exposed to secondhand smoking? Do you have mold in the house? Humidity? Do you have a carpet in the house? And then, you know, the next thing is, you know, self-report is not always very reliable. That's when we use the sensor that actually was talking about, is how we can actually reliably detect some of these changes, and we can actually typically connect it with an upcoming event. That is, you have a peak in exposure to secondhand smoking in the household, and next thing you know, it's a child that starts going into the emergency room frequently. And the flip side is true too. So we start a smoking cessation program, and we educate the parents or the caregiver or whomever smokes indoors to move the smoking outdoors and to do a few things: wash your face, change your clothes before you get back in the house. And all of a sudden, the child is not as sick, as often sick. So objective ways of measuring that exist, including these indoor sensors that can definitely help detect some of these pollutants, but also housing inspection. It's important to be able to send folks in the house to go and help folks, families identify where mold is, whether there is mold or not, mildew inside of the house, humidity, the carpet, if there's dust mite. Those are things that can definitely increase your health risk. And actually, did you want to add something about the indoor air sensors?
Yeah, sure. Like, so these sensors, we collaborated with a company called Nanovision, and they developed these sensors at a very low cost, and they gave us for these experiments. And it's good because they come with the IoT and wireless capabilities, and you can place them anywhere in the room, and they're very sensitive, and you can get data from them real time. So our initial experiments with them have been really good. So
and you know, that's part of the general move towards the Internet of Things. That is using sensors to identify issues without having, like, people can actually lead their lives while we're monitoring their environment, monitoring their health, and then implementing interventions to help them get better, because some of these issues are not obvious to folks. But once you know, you get some way of measuring those potential risk factors in an objective manner, then you can actually design interventions around this, mobilize the community, mobilize policymakers to make a difference in these folks' lives. So yes, inspection, Internet of Things sensors in the household, and you know, just plain old inquiries, questioning can help us identify where the risk factors lie.
Yeah, it's extremely important to identify the problem before you go out and impose a solution, because you may be doing something that doesn't have any effect if you don't know the actual problem. Let's say that I was, and this is kind of directed more to Akshay, that I was that I owned a business or owned a facility, and I was interested in getting some of these sensors installed. Do you guys sell them, or would you be willing to work with people that wanted to volunteer their place of work or something like that as part of your program? How would that work?
That's a great question, and part of the question I'll try to respond like with more information after checking with the internal PCCI team. But first part I can say that we did it for a specific research study, and we did with no motivation of commercializing and no motivation of creating a product or an app out of it. It was just on a research study basis to understand and do a proof of concept kind of an app to see if this is really effective. And but yes, we once we discuss internally, we can get you in touch with the vendors that create these sensors, and
Okay.
we can facilitate the whole data engine that we have built behind the sensors.
And just to supplement that from Akshay, we have an asthma program that we've been running. We've expanded it from the Parkland Community Health Plan, where we predict for their children with asthma the risk for having a bad asthma attack within the subsequent few months and help them do proactive interventions. We've expanded it to the Dallas, to many other zip codes in Dallas County. One of the things that we were doing this research for was to see if we could enhance that prediction model using those indoor sensors, and that was a positive finding. So we're more than happy and open to collaborate with folks to see how this can be used to actually help the broader community. We certainly can get back with you with the specifics. And there are different sensors, so we're not married to any specific sensor from any specific company. It's all about the quality of what we.
Yeah, the quality of the data from these sensors is extremely important. I know that we work with some of the outdoor sensors, and sometimes the data quality is very good and it's very useful, but oftentimes the data quality leaves a lot to be desired. And in that case, it's almost like not having any data. So the other thing that I have found that's very important is how you interpret that data. And it's something that requires a lot of special knowledge to interpret, and the average person trying to interpret it may jump to the wrong conclusion, either good or bad, and so that's really important too. I'll just throw that out there. I have one more question. Vanessa had says, can the sensors be requested, or do you need to be a part of a study to participate? And I think the answer is that you can buy the sensors, that you guys can help people locate sensors that will work for them and work in their situation, but that you don't necessarily just put them out everywhere that upon request. So that's I think that answers that. Another person also typed in that he had an experience similar to mine working in a large warehouse type building, and I think that's a lot more common than we know about. And I think going forward, that's going to be important to all of us for learning how to take care of ourselves better. And we all, after this last 18 months, know that we need to take better care of ourselves. I'm going to finish this up by asking you guys to just say a little bit about PCCI and what its purpose is, and the history of it, and what you do. Just how you interact with the public. So if you could kind of just say a little bit about that, whatever you want to say, I would love that.
Sure. Well, thank you so much for the opportunity. So PCCI is the acronym for Parkland Center for Clinical Innovation. So we incept from Parkland. We're a nonprofit research and development organization here in North Texas. And although we incept from Parkland, we actually work with multiple health systems here. And what we do is we leverage data and technology and identify social determinants of health to target those vulnerable populations to help improve their health. And the way we do that is through advanced analytics, machine learning, predictive models that pick data from different sources. We build models using health system data and community data and patient level data and household data, all that put together to identify folks who are at high risk for health issues, but we also have a high social risk because we know all those are interconnected. Your social risk determines your health outcomes. So when we build these reports, we make sure that these information get into the right hands of the people that can actually do something about it in a timely manner. So we work with health system, we work with community-based organizations, we work with, we support organizations and professional associations locally and in the state to help them with their policy issues through very pointed and very well-oriented data analysis. And then we use technology to help folks improve their health. Typically, something as simple as a text message that educates folks about asthma can actually curb the risk for asthma exacerbation, asthma attacks by quite a bit. We've been able to demonstrate that through our activities, but the key here is to target the right information to the right person. You can only do that if you have the right data insights, which is the things that we work on. So that's what PCCI does, and our mission is to support our communities nationwide, but certainly focused in Dallas first, improve our health outcomes and target interventions, both health and social interventions to the vulnerable members of our communities, so that we can improve their health and target their outcomes, improve how they play, how they live, how they learn, how they worship, make sure that all those places are a safe place for them to live at. You're on mute, Kevin.
Always catches you off guard when you do that. That's great. I think that what you guys are doing is so important and is really with the times, that we have all of the, as we go into the information age, we're well in the information age now, and we have so much information, and oftentimes it doesn't get used correctly, or it doesn't get to the people that can use it. And organizations like yours that help move that along, and also I will say that your targeting of the information and everything is something that we're learning about with our messaging and our outreach program, and it's something that I don't think they teach that in school. I think you have to go out and learn it. Maybe the next generation they will, but for now we all are having to learn it. So with that, I'm going to wrap this up, and I'm going to kind of give a rundown on what's coming up with the Earth Day Everyday program. On June 28th, the Grow With Us program will feature a topic called Fall in Love with Organics. And we're going to have a gardener come in. A gardener is going to, I'm trying to read what this says, but anyway, they're going to talk about going organic and pesticide free with your garden. And I've been that way since about 1987. I have a story that I tell on why I became an organic gardener, and that is one year I had these beautiful tomatoes, and I had red spider mites all over them. And one of the people on the radio that's still on the radio said to go and get this pesticide called Kelthane and spray on your tomatoes, which I did. And then after I sprayed it, I read the label, and it said that if it got on a tomato, that you couldn't eat it. Even after it became ripe. And I was like, well, what was the point in doing that? So anyway, that's organics I'm all in favor of organic gardening, and I think it's a great idea. On July 8th, the Earth Day Every Day will be kicking off Plastic Free July. And on July 12th, the Grow With Us will be composting for the home gardener. And on July 14th, we will have Wild About Weather for K through 12. And I will probably tune into that as well. As someone who does a lot of air pollution, I've worked in air pollution field for many years. I've worked with a lot of meteorologists, and I'm not a meteorologist, but I did stay at a Holiday Express one time. And meteorology and weather is a fascinating field. And if I had known about that when I was a kid, I might be a meteorologist today. So I'm really excited about that. And with that, I'm going to thank everyone, and I'm going to turn it back over to Vanessa.
Thank you so much to all our presenters today, and thank you, Kevin, for handling the questions so well. I think you covered what's coming up, so thank you so much for joining us today. And you will receive a follow-up email that has some more links to some of the programs mentioned, and as well as a link to watch the video again or to share.
Thanks, Vanessa.
So Vanessa, thank you for having us. This has been a fun month, and I've really enjoyed it. So hopefully we can do it again in the near future.
Yes, definitely. Yeah, I think air is something that we take for granted that we need clean air to be able to breathe and to stay healthy. So it's definitely a very timely topic.
Well, thank you.
Thank you.